Hi, this is Dr. Kate, and on today's podcast, we're going to be talking about the pelvic floor. I just took a class yesterday with Herman Wallace, which is a pelvic floor educational group that does a lot of training on a variety of pelvic floor techniques and that kind of thing. It is a PT-based organization. I've never taken any of my pelvic floor courses from them. I've done hundreds of hours of pelvic floor courses, but I've never done any with Herman Wallace. But I do know some good PTs that have. They had this course that was specifically on how shockwave therapy is utilized for pelvic floor issues. And I was a little surprised when I got the packet that they did have some male issues that we were going to be covering as well. They went over how to treat erectile dysfunction and prostatitis. They even showed how some of the research is showing that if you treat a certain area, it will increase the testosterone level. So all pretty wild stuff. So we know that shockwave increases blood flow, breaks down calcification, and stimulates cell regeneration. And they're utilizing this for erectile dysfunction of a certain type that is tied to blood flow restriction. So that is what the treatment there is. Now, that is definitely not something we're going to bring into our office. It's not in our scope of practice. But with the women's health pelvic floor, we also covered not just like pelvic floor pain and that kind of thing. We also covered interstitial cystitis and incontinence, which was pretty wild. In my mind, when I had seen that on the handout, I was thinking they were going to be showing us possibly how to treat the bladder through the abdomen right above the pubic bone. And actually for that incontinence and interstitial cystitis, they still use it from the pelvic floor up to treat the urethra and affect the bladder in that way. So all of the treatments for pelvic floor pain, whether it's be vaginismus or something similar, same application. What was unique about this course, and all of the other courses I've been to were specifically for the type of shockwave that we have in my office. This course was just a general shockwave course, not specifically Piezowave, which is the type of shockwave that I have. So with this course, they really hammered home. They had 16 slides on the fact that this type of therapy and the research that's coming out that shows good progress with incontinence, vaginismus, those kind of things, is using focused shockwave. So there is a pretty significant difference, and we have a podcast episode on it, between radial shockwave and focused shockwave. Radial shockwave is actually not a shockwave. It's not a true shockwave. And focused shockwave is, and that's really where the difference lies. So radial shockwave would be a lot more painful in that area to get into the pelvic floor. It is going to have the most power at the surface, which would be the labia, and then dissipate from there. So that's where the more pain comes in. Because it's not the same amplitude of a sound wave, it's not creating that cell regeneration, which is really important for the long-term benefits. With focused shockwave, they also went over how Piezowave affects that outcome, how Softwave affects that, and there's a bunch of different types of shockwave and like how they're different. It was just very good to look at all the pros and cons of all the different ones, but for this type of work, they're not looking at radial at all really, and they're focusing more on focused, depending on what makes the sound waves or the shock waves, basically. So it's very interesting. Really excited to incorporate that a little bit better into our practice because I have such a long-standing history. If you look back at our old podcast episodes, we do a ton with pre and postnatal, and a lot of times that pelvic floor issue can be experienced not just by my pregnant patients, but postpartum and even 20 years out of postpartum. And then something to keep in mind too is that not only women have pelvic floor issues, men can have it as well. And sometimes pelvic floor issues from the pudendal nerve and those kind of things are also going to give you erectile dysfunction. And if that's the case, then medications are probably not going to be the best bet for you in that regard. You really have to address the pelvic floor issues to fully get resolution of those issues. The other area they really talked about treating was the pudendal nerve, which it comes off the tailbone. You have little holes along your tailbone and the nerve roots come out and then they form different nerves. And if we trace that nerve out from where it goes from the nerve roots, where it combines and then out and under, that will affect the function of the pelvic floor, but also the reproductive organs. So also very helpful to treat along the innervation of those areas. So just a very, very interesting seminar, lots of research. They had just dozens and dozens of research articles, and they helped us pick apart how we determine what is in there. So like they said, radial shockwave is not focus shockwave, and when you have that in the research and you're not sure which one you're looking at, it's going to be a very different outcome because of the just different mechanism and no cell regeneration with the one. So all very interesting stuff, and I'm really excited to introduce it to the office. And if you have any questions, feel free to let me know. We'd love to answer those for you.